speaking about that mistrust in your report, you highlighted that underrepresentation of Black healthcare professionals also just adds to the inequity we see in the health system. And something I learned today, actually, which I thought was just shocking, was how back in at Queen's University in 1918, they strongly encouraged their Black medical students to leave the school, and just to reflect like the racist beliefs of society at the time. And so this is in Canada, in Kingston, and they said essentially their community doesn't want Black health professionals, so the Black medical students should leave the school. And so following that, in 1918, they had a ban on Black students entering medical school until 1965. And so that's in our parents' lifetimes, that's fairly recent. And so people may say, oh, well, why don't we have more Black people within the health system? Are they just not achieving that goal? But okay, let's look at what systems were in place that prevented that access.
This is the Public Health Insight Podcast. Before we move on, it is important to note that the views expressed in this podcast are our own and do not represent any of the organizations we work for or are affiliated with.
Dami Lwal, Danielle Rawlinson, and Lwam Mehari remain for part 2 of our discussion, highlighting key findings from a collaborative report titled The Urgent Need for a Systems Thinking Approach to Address Anti-Black Racism in Ontario, a call to action for decision makers and policymakers. In this episode, we will examine systemic anti-Black racism in the justice and healthcare systems, as well as some strength-based approaches and some next steps for those interested in becoming more involved in the fight against anti-Black racism. This is where we left off in our discussion.
So I'm here to give Gordon's voice a break, and then we'll talk about the justice system. So as we know, Black communities also experience racial profiling and higher rates of incarceration compared to the general population. And I was hoping that we could discuss what ways does our justice system continue to harm Black communities, and what were some of the more shocking things you found when you were preparing this report?
It's clear and prevalent that the justice system is biased, and racial profiling is prevalent. We had carding years back, which disadvantaged many Black youth, and I just think that nothing really shocks me when it comes to the justice system in regards to how it kind of marginalizes Black people further. And clearly in light of this report, all the murders that happened in the US, let's just be clear, all the murders by police and things of that nature, highlight on a more overt level, I think, what happens in the justice system. Here, obviously, it's a little bit softer. You have people who have experiences where they're carded or they're racially profiled, but there are people who have been abused by police, off-duty police, or they've actually been targeted specifically by police. And I think that a lot of people don't believe it in Canada that happens, and they just look at the States as an other, right? But it happens here, and I think highlighting this again with facts and numbers is very important, because it's the system. The system is inherently ingrained to be, anti-Black, and it's unfortunate. And it's just weird that I parallel a lot, I think, with Indigenous communities, because I feel like they for some reason, those communities were able to get the support to kind of make changes within the judicial system. For example, they have the Gladue report, which, essentially when it comes to sentencing for Indigenous people, they take into account their historical disadvantages through, residential schools and essentially having their land taken away from them. And I think that that's something that, again, we can really just jump off of as Black people. And I think that's a safe way to start, because, we have similar experiences, obviously unique to us. But I think it's important that we kind of look to what's already created and kind of tweak it to assist the Black community, because, sentencing for Black people is just disproportionate as well, right? Like, you know, how many Black people were arrested for cannabis and still have, you know, they still have a rap sheet for that, so to speak. You know, there are criminal lawyers who are trying to change the policies and change, you know, at least highlight for people that they can, you know, get that removed from their names, like that they are not criminals. But unfortunately, you know, the government's not going to tell them that, right? Right. And it's just, yeah, it's sad, but it's just a true reality, I think, in our system.
Yeah, and over time, the police force has not been a very positive presence in Black communities, specifically low-income, highly racialized communities. They're a presence that's often feared or met with resistance because they've seen so many negative interactions with their brothers, their cousins, their family members, their friends, their neighbors. And I think because of that, if we're talking about like police reform and things like that, like there's a reason why statements like defund the police are made. It's because there really needs to be a rebuilding and restructuring of the system that completely takes into account community needs and why there is resistance in those communities and certain fears, and then building on that to come up with solutions that actually help to improve outcomes in highly racialized low-income communities with high rates of crime.
Yeah, and just like going off of that, during the course of this research, a key thing that I guess came to light was like understanding the difference between like the police department being in a community to serve that community and dealing with their population specific or community specific issues versus them like I guess taking up space in the community and like being at a disservice to the community members. Like a fact that I remember saying was that the police in like downtown Toronto, Black people were approximately 17 whole times weren't likely to be carded than white people. Like, we're not talking 2 times, we're not talking 5 times, 17 times, like, huh? Like, that's like a big disproportionate measurement. And I guess
targeted.
Exactly. And if you think about it, it's like, if police are being deployed to high crime neighborhoods, so neighborhoods with more Black people, it's like obviously there's going to be a higher concentration of people that they're actually catching or taking or carding, and that would obviously further impact the amount of stats that you're seeing. Like, okay, so now more police are being deployed, so obviously you're seeing more Black people in there, which is further reinforcing the stereotype, which is further affecting the way they're seen, they're perceived. And there's the whole like, you know, self fulfilling prophecy. That was like a big thing that was also said during the research of this report. So these are just like important aspects.
That definitely impacts the interactions with police, right? Like if you feel like you can't actually reach out to police for help, right? You're going to fear the police, then your relationship with them is broken. And it's just a cyclical thing, right? So it's not just a fear, but it's a distrust of the police. And when there's no trust and the police feel like they're not trusted and there's fear, right? They reinforce that with, you know, this kind of power trip that they have, and the relationship will never be mended. So it's just a cyclical issue, and it starts from I believe, yes, like defunding a lot of defunding the police. They're going out for wellness checks and things where they shouldn't be, you know, going out for. They don't have the skills. They've admitted they don't have the skills, and I think that it's important to kind of like reevaluate what the role of the police is in these communities, and then from there, you know, reestablish that relationship.
Absolutely.
In my journey to understand what defund the police means, that's some of the things that I came across. Like, oftentimes people think, you know, the rhetoric, you know, south of the Canadian border, from, you know, who is often that, you know, by defunding the police, when there's an emergency, there's going to be no one there to help you. But what defund the police really means is there are certain instances where a police response is not effective or appropriate. And in those kind of situations, different kind of more specialized resources will be used to address those situations. So You talked about, we know firsthand that a lot of the times, first responders respond to a call. It's a lot of times mental health related issues. So is someone showing up with a gun the best way to kind of talk someone down in a crisis situation? I don't know. If there are other kind of specialized supports like social workers that respond to those calls, do they need some kind of protection in some instances? Maybe. So it's not about the police just being abolished, and there's going to be no systems in place to ensure the safety of kind of civilians. It's just that constantly increasing like police budgets to deal with a lot of these problems is not the solution.
Mm-hmm.
Yeah. And a lot of that money can be reinvested into community initiatives as well. Like, what are we doing to build a community, like youth programs, getting them invested in things that are, contribute to academic career growth or just positive reinforcement, as well as initiatives for increasing opportunities for employment, so that, in low income areas specifically, youth aren't having to resort to, illegal measures to try to get money just to put rent down or make payments for food, that there's actual other opportunities out there that give a livable wage to these communities. And what are we doing to invest in that financially and with human resources?
Mm-hmm. Yeah, and I think something that really came out of this report that was evident in all four of the systems mentioned is that the Black community or the Afro-Canadian community isn't just like one singular entity, right? There are, like as we mentioned in the previous section, there are specific sections of that population, such as women or those who identify as 2S LGBTQ plus, who are further discriminated, further stigmatized, and experience additional levels of racism, discrimination, and inequity that makes their experience, I guess the impacts are felt even more, essentially. So I think it's one of the ways that we just see these systems continuing to impact these communities, not only just the Black communities, but the specific subsections of these communities. That was definitely, I think, an overarching takeaway from this report.
Yeah, and I think the point that Gordon mentioned regarding first responders and how our healthcare system is also affected is a great segue to go into that part of the report, because we know that people often see the healthcare system as a place where you can get to go for help for medical conditions. But the reality is that many populations, such as the Black community, experience disproportionate harm when utilizing these healthcare services. We know that systematic racism in the Canadian healthcare system is driven by various factors, and I wanted to discuss some of these factors that were highlighted in the report regarding that system.
Yeah, I guess speaking from personal experience too, and even things I've read, we know that I think in the pain management side of things, healthcare providers are more likely to see people of color as, drug seeking or drug users, and they might not get the appropriate supports that they need in certain situations. And I know there was a study, I can't remember the exact numbers, but white people essentially were more likely to be prescribed, kind of more effective pain relievers than Black people when seeking healthcare help. So it just goes to show that there's some inherent biases and stereotypes held by our healthcare providers that prevents us from getting the proper medical care that we need relative to other populations.
Mm-hmm. And another, key thing that I noticed or we found is the insufficient research for people from the Black communities. So obviously the lack of research would also impact what solutions are available for Black communities. So now take, for example, a COVID-19 vaccine is coming out, and obviously people are excited and whatnot, but right off the bat, even just talking to people around, it's there's that whole mistrust, okay, when they were researching it, were Black people actually part of the people they researched, or were they part of the trials, were they part of were they kept in mind when coming out with the solutions? And obviously that contributes to the mistrust, because again, there's that history. For example, the Tuskegee experiment, it's a really big part of why there's this big mistrust. But no, we want to categorize it as Black people are not compliant. or Black people who don't, take these things seriously, or like even some of the things that are taught in schools on how to notice. For example, now COVID-19, one of it was, if the person's turning blue, excuse me, I can't turn blue. So how are they gonna know? So just little things like that. Like there needs to be more ways to be able to achieve the same service, or to provide the same service for people who, again, can't turn blue, or people who wouldn't have the red bullseye rash on their arm. Like, how else should a healthcare professional be able to cater to Black people and help them before it's too late? These are kind of things that we found while researching for this report.
Speaking about that mistrust, in your report, you highlighted that underrepresentation of Black healthcare professionals also just adds to the inequity we see in the health system. And something I learned today, actually, which I thought was just shocking, was how back in at Queen's University in 1918, they strongly encouraged their Black medical students to leave the school, and just to reflect like the racist beliefs of society at the time. And so this is in Canada, in Kingston, and they said essentially their community doesn't want Black health professionals, so the Black medical students should leave the school. And so following that, in 1918, they had a ban on Black students entering medical school until 1965. And so that's in our parents' lifetimes, that's fairly recent. And so people may say, why don't we have more Black people within the health system? Are they just not achieving that goal? But okay, let's look at what systems were in place that prevented that access. And so perhaps we may see change now after this policy, for example, at Queen's has been removed, but the impact from previous decisions is still present.
Yeah, and it also calls into question, if those were the ideologies at the school at the time, what did the curriculum look like? How representative was it of Black patients and Black healthcare providers and like specific needs in that sense? I know that there was a research study that was done that showed that 40% of first and second year medical students thought that Black patients actually had thicker skin, which led to less pain. And so that Black people feel less pain than white people do. And these are people that are going to go out into the workforce and then serve Black patients. And what does that look like in practice? And how does that impact Black communities? So when we look at things like, again, maternal mortality rates, high rates of hypertension and certain disease, it's not because our biological makeup is different from white people or other races. It's because there's something going on in the healthcare system that's impacting Black communities, and it stems and is rooted in racism.
I'll share a bit about something that kind of comes up in a lot of my work, working with the Pan American Health Organization, and just they emphasize so much on race disaggregated health data and things like that. But I think there's often a lot of problems with simply just collecting data for the sake of it, right? It's like, I think it's as much as collecting race-based data, it's also important to include the cultural components of that data, because just I think we already recognize that there are disproportionate inequities among races, but everyone knows that's the case. But what are you looking at? You need to kind of dig deeper into it and see which aspects are protective, which aspects are risk factors, and I think a lot of the big part of that would be analyzing and considering the cultural components, right? Mm-hmm. So I think it's one of those things where I mean, from definitely a policymaker perspective, it's more of a low-hanging fruit, easy decision to make to kind of just please the public. But realistically, what are the impacts, and does it actually make a difference?
Yeah, and I wanted to bring it back to Danielle's point about education that was brought up in the other systems, is that we find that a lot of the education is very white-centric. So, for example, from my work, when we look at cancer diagnosis for specifically skin cancer, what's being taught in the books for medical education is not reflected for people of darker skin. So that immediately affects the health outcomes of that population, right? And then when we look at innovations within these healthcare systems, we find that they're also white-centric. Oftentimes they're built on racist ideologies through systemic means. For the case, the notable symptom of Lyme disease is that bullseye rash, which is not easily seen on darker skin. So again, it's like Lwam mentioned before, these ideologies that were present historically. And then as we know through research and medical education, there's always that lag. There's always that 20 to 40 years where it takes time for this to be implemented. But if people don't even realize this is an issue, how can you even bring that up, right? So that's something that the report also talks about.
And just to add to that, Ben, oftentimes even in higher level education, like university or graduate school, we're taught to narrow our scope when we're doing research to just higher income nations, which are usually Eurocentric. And so, of course, a lot of the data that you're finding is not going to be specific to communities of color. And why do we have this idea that that's better data than maybe data that comes from different continents that are more racially diverse? And I think that we really need to get out of that idea of only focusing in on higher income nations. We're looking into research, specifically medical research, and figuring out how to better serve Black communities.
Absolutely.
Awesome. It's a great discussion, guys. I could be here all day, but I know everyone has their own life to live. So this is going to be our final segment. So one thing that I always find, and, when there's kind of, racial minority, or ethnic minority at the subject of a discussion, we often get into, I think the word they use is pathologizing, this race or this ethnicity just have, it's just all bad and there's nothing good, and you get into this doom and gloom, and then, the very problem that you're trying to avoid or issue that you're trying to solve, what's happening in those cases is that people might lose a sense of hope because things are considered quite bad, right? So for this part of the discussion, I want to highlight more of a kind of a strength-based approach to addressing some of these systemic inequities that we see throughout all these systems, and what kind of, whether it's in your line of work, what you're doing on a daily basis, your colleagues, what you see of other organizations, maybe speak to some of the important work that's happening in those communities, led by Black leaders, if you will, to address some of these challenges that we see that are hundreds of years in the making and still a challenge today. So let's get into a little bit more about some of the good that's happening to address some of these issues.
I think I wanted to start just because I'm in a profession where we strive for equity, inclusion, diversity, supposedly. However, the percentage of Black legal professionals in Ontario and throughout Canada is just a speck in comparison to non-Black. And when I got into this profession, I wasn't really thinking about that. I was just kind of thinking of making it through law school, but through the Black Law Students Association of Canada and further through the Canadian Association of Black Lawyers, I just saw that the Black legal community is so strong, and that they're actually advocating and actively pushing for change through whether it's through diversity and inclusion initiatives, by highlighting Black legal professionals within the community, putting them on a platform in which they can make change. And I think that's very, very important. They actually had before, and it's closed down for a bit, and now it just reopened, the Black Legal Action Center. So it's a legal clinic for Black individuals, and I think that's very important to have because some people want to be represented by people who understand their lived experience, and I think that's important to have, and I think that that's a great initiative to have. The Law Society itself has a diversity and inclusion department, which some recent ventures have tried to eliminate. So there's a lot of politics going on throughout all the professions where non-Black lawyers want to just push it under the rug that there is any issues with diversity and inclusion or systemic racism within the legal profession, for example. And I think that the key to a lot of this change is going to come from the younger people, the youth, the new people coming into the profession, because they are so passionate and so brilliant, and they're pushing for change, like actively pushing for change. And for example, there's a new program called Black Future Lawyers at U of T, because I believe they only had like maybe a handful of Black law students at U of T at one point. And now they have an undergrad program to kind of push Black students into like law school, providing them with the tools and the mechanisms to prepare them to enter into law school and to enter into the profession. So I think, a lot of it stems from grassroots organizations, but also people working within the system and kind of assisting, in changing it from the inside out. And I think that's very important. So I think, from a legal perspective, I see the changes slowly happening. You see the big firms who typically would not hire many Black students are starting to have a diversity and inclusion, portfolios within their firms. They're taking the steps, and I think that's very important. So change is slowly happening, I think, and I think it's to be honest, it's in light of the killing of George Floyd and the whole Black Lives Matter movement this time around, because we've had these movements before, right? So.
I guess I can share some I guess strength-based approaches from my work. So as I mentioned earlier, the Pan American Health Organization, which is the WHO's regional office for the region of the Americas. This is an organization that, despite kind of all the controversies and issues with the UN system and just multilateralism in general, the organization at its current state right now has placed a lot of emphasis on ethnicity and health as one of its priorities. The current director of the organization, her name is Dr. Carissa Etienne, and she is a Afro-Caribbean from Dominica, trained MD, public health professional. She's been she's in her second term as the director of this organization, and she has made it her goal to include the health of Afro-descendants as one of the part of the PAHO health agenda. And a lot of the work that's being done, whether it's consultations with member states and the inclusion of Afro organizations from across the region, or commissioning reports looking at discrimination, racism, stigmatization across the region. I think these are all good efforts in moving forward for the region, at least on a political level, and also on just for the organization to include as part of its strategic framework that these are important topics to cover as well. I think it's quite cool to see that at least for the Pan American Health Organization, that a lot of the work that they do, especially with Black and Afro descendant organizations, they emphasize a lot of it really on working with the community, having community representation at the table, and specifically focusing on these vulnerable populations that we discussed earlier, like women, and providing them a seat at the table so that they're included as part of the decision-making process, and that that it's individuals from the community serving their own community so that they know exactly what's going on. And I think it's good work. Obviously, with everything, there's a lot more progress that needs to be made, but I think it's definitely kind of in line with this segment of our discussion today. It's looking at the positives. It's definitely going in the right direction.
Yeah, some other organizations that I think are really useful in terms of even just looking on their websites and getting information on different things that are being done at both the provincial and national level. There's the Black Health Alliance, whose mandate is to improve the health and well-being of Black communities in Canada. They have a lot of great information on their website, and a great resource to reach out to for more information on what's happening to try to advance the health of Black Canadians. There's also Black Lives Matter, which has a Toronto branch that focuses on dismantling all forms of anti-Black racism and oppression in an effort to liberate Blackness and support Black healing. So those are some initiatives that are being taken right now that I think are really important with respect to anti-Black racism and tackling a lot of the issues that we're facing in our communities.
Awesome. So I guess on that note, from everyone's perspective, whether it's a call to action directly from the report or kind of just a message to the listeners about where to go from here. From your perspective, I'll open up the floor to maybe, everyone here to share a little bit about their words of encouragement or, anything they have to say on chartering a path forward in terms of anti-Black racism.
I think just, educate yourself on these systemic issues, i.e. read this report. Once you're empowered with the knowledge from this report, take some action. Reach out to your local government, reach out to your provincial government, and make yourself heard. Voice your concerns, right? Like, we need to kind of galvanize everyone to voice these concerns so that they can be taken seriously and so that we can, have a voice at the table to implement these changes, right? That's how other groups do it, and that's what we need to do as well. We need to come together as a community and really push to have our voices be heard. And it starts with educating yourself and understanding how these systems do oppress you as well, right? Because some people may not understand the inherent, biases, and I was not aware of the healthcare instances, and it took me aback when I was understanding that, through the educational process, a lot of the things that doctors learn when they're going through medical school is that there's, inherently racist teachings in terms of like how to treat patients. So things like that are very important for, I think, people to be knowledgeable about and then take that action.
I'll hop in next. Coming as a person of South Asian descent and obviously darker skin, my message would be to, even if you're not Black, be very aware of how your culture may be complicit in anti-Black racism. So what was really eye-opening to me in my culture was there was always this talk of being the model minority. People with lighter skin are favorable. You'll have more success in life, change your name, et cetera, et cetera. And there's a lot of parallels there. So be aware of it, educate yourself, educate individuals in your community, your older family members who may not be as educated. Read this report, and as Danielle said, reach out to the levers within the governance of your community or within your local area to advocate for these things that we mentioned in this report, because they are important. And, we are all affected by them in some way.
Yeah, like a big thing is like obviously so much work has been put into this. There are facts, backing all these things up. I guess a big difference with this one is, like we said, there are actionable steps. So see, like someone mentioned earlier, see what step you can contribute to. See how you can bring or garner conversation about these steps, because like in this day and age, being an ally looks like different things, but just figuring out what being a good ally looks like for you is a big aspect of this. And there are many areas we touched on, so definitely at least one should like pertain to you or speak to you. So just like trying to figure out which one that is and try and be a contributor to the change we're seeking or the progress we're trying to achieve.
I would call on institutions and systems to take greater accountability, to be more conscious of how their systems might be perpetuating racist ideologies or harming Black communities and other communities of color, Indigenous communities as well, and really dissecting the areas in which they find the flaws in their system and actually working towards rebuilding it. It's more than just identifying the problem. It's working towards a solution, and not working towards a solution alone, because there's so many community organizations, Black community organizations specifically, that can assist and aid in helping institutions to find viable solutions. And yeah, just bring in those community members to the table, ask them what their needs are and how they can make the most impactful change.
Yeah, even just to kind of reiterate what people have said before, I think education is key. So, which is why this report is so valuable. It's accessible in terms of like the language. For a majority of people will be able to understand and take something away from this. So I recommend, even if you don't have a background in public health, take a look at the report and look through the calls to action, because there's something in there that could resonate with most of us, I think. So, and then from there, take action in a way that you're able to. And so for me, in a health research background, specifically with this COVID pandemic, like this is like a call to action for myself, is to work on getting support for more race-based data that is actually helpful in this pandemic, that will have an effect now, not in like 5 years from now when we look back on this pandemic. So
my call to action would be, the issue of racism is, I find it's, especially with the current messaging that we see, it's often very closely connected with the justice system. But I really encourage individuals from non-traditional fields such as public health, education, urban planning, whatever it is, to find how this issue fits in with your field, and I guess look to see how from that perspective you're able to contribute to the change. Because we need to have innovative solutions. We need to have outside of the box ideas and just thinkers to kind of really come together, because realistically racism is a whole of society issue, and we need to really just, as we talk about so much in public health, multi-sectoral, interdisciplinary, break down the barriers, break down the walls and silos, and just work together to tackle this problem, especially the individuals or the fields who typically aren't brought into the discussion.
100% agreed with what everyone said, and I would just add another element to it. At an individual level, we're learning more about a lot of different terms, allyship, performance allyship, and this and that. And everyone knows that I'm not a big fan of a lot of different terminology, because it's a very monumental challenge that we have in front of us. And if you look too far ahead, you might get a little paralyzed about what you could do. So each one of us can kind of implement new ways of thinking in our life to kind of be aware, be more reflective of what the situation is. And small change is good too. You don't have to be on the front lines of a protest you don't need to show anyone. If you are doing the work, you don't need to prove it to anyone that you are doing the work. You could start small, like in your workplace. Maybe you notice that, hey boss, we don't have a lot of diversity in the workplace. It could be something small like that. You don't have to be on the front lines to change the world. So you can change the world by starting in your own workplace, your own communities, your own institutions, and then collectively those changes will have a big impact. And with that, we're signing off.
Thank you for listening to the Public Health Insight Podcast, your go-to space for informative conversations, inspiring community action. If you enjoy our content and would like to stay up to date, follow us on Instagram, Facebook, Twitter, and LinkedIn. To learn more about our community initiatives and how you can support us, visit our website at thepublichealthinsight.com. Join the PHI community, and let's make public health viral.